Claire, could you start off by telling me a little bit about the research that you do and how you got into this particular field?
Hi Janet, yes. Well, I'm really interested in how we can diagnose disease in people because, as you know, it's very, very difficult. You go to the doctor and you've got something wrong with you. Actually trying to get a diagnosis is quite difficult, and quite often they need to cut bits out of you or stick probes in you.
Do a biopsy or something?
Do a biopsy or an endoscopy or something like that, and it's really not very pleasant. And we have known for quite some time, in fact the ancient Greeks knew, that people who had particular disease or a condition exuded a particular smell. So we knew that people had the smell of rotting apples, they were likely to have diabetes, or if people sort of coughed up sputum, they put it on the fire and there was this really foul smell. That was very typical of tuberculosis. Nice. So even the ancient physicians kind of knew that you could diagnose disease from the way somebody smelt. Now, of course, this was largely ignored until about the 1970s, when they started actually investigating the possibility of using odour to find out whether someone had a particular disease. And this is the origins of analysing breath. So quite a few years ago now, when I was first involved in this area, we used this instrument and we looked at a whole load of healthy people and we monitored their breath over quite a long period of time.
So that's your control group?
Absolutely, that's a control group. So we're able to measure all these people and work out kind of what is a normal healthy breath sample, and we had a range of ages and a range of body mass indices, race, and both genders, and we were able to characterise the breath samples for all those people, so we then knew what was healthy. Then the next stage is to take that research and start looking at people with different diseases. And what we've done is we've got them to come into our laboratory and they provide us with a breath sample.
Okay.
So we take a device like this, which is just...
It's just an ordinary cardboard tube?
Just an ordinary cardboard tube. And they can put their mouth over the one end and the other end we attach to the back of this instrument here.
Ah, so this instrument is pretty much key to your research.
This is a key instrument. This is a type of mass spectrometer, and what it can do is it can measure the concentrations of various components of gases and also compounds that are just in the air, volatile compounds that are in the air. And it can tell you what is there and how much of that stuff is there. So the work that we did on looking at healthy volunteers' breath, for example, this was done on this instrument.
Okay.
And then from that, what we've done is we've started to investigate different diseases and look at how breath varies in people with those different diseases.
So you said you're looking to detect different kinds of diseases by the compounds that are released. What particular diseases have you looked at and what kind of compounds do they give off?
Okay, so we've looked at quite a few different things, both in breath and also in urine and fecal samples and other samples, and I'll talk about that in a minute. But we've looked at things like diabetes, whether we can actually monitor diabetes using breath instead of using blood tests. Okay. We've also looked at things like tuberculosis. We've looked at bladder and colorectal cancers, inflammatory bowel disease, and other infections. We've also looked at colic in horses, believe it or not.
Right.
And things
the
like
racing
that.
business is big money, isn't
exactly, it? Exactly, it is big money. But of course, the issue with breath, although it's a lovely sample to take because people don't mind giving a breath sample. It's very quick, it's very easy, it doesn't hurt them, they're not embarrassed about it. In fact, people are quite interested about it. The problem with this is this instrument here weighs about half a tonne. We can't easily take it to a hospital. Exactly. So then what we have to do is we have to get a breath sample from a patient in a hospital, and we might do it in something like this. But still, transporting breath samples also has issues. So because of that, we've also looked at other ways of analysing compounds, if you like, and we've taken urine samples, which is another sample patients really don't mind giving. It's completely non-invasive. But the ideal thing about urine samples is you can freeze them and analyse them when you like. And it turns out that if we take some urine and we put the urine, just a couple of millilitres of urine in a bag like this,
right,
and we add just some clean air and heat it up slightly in an incubator and attach it to the same part of the instrument where someone breathes in.
So the vapour comes off.
Measure the vapours that come off the urine, and that will give you a profile which is not the same as breath, but it also gives you similar types of information about the condition that you've got. So we've done some work on looking at bladder cancer. We know that the vapours coming off urine from people with bladder cancer differs from the vapours of people without cancer and healthy people, and also people who've got conditions that are similar to cancer, look like cancer, but we know they're not. So in other words, the sick person goes to the hospital, we can tell from this, rather than using the very unpleasant invasive tests, that they have bladder cancer or not.
So this machine is a bit like a cancer sniffing dog.
It's just like a cancer sniffing dog, only cancer sniffing dogs are great, but they have bad days. So they are very susceptible to environmental conditions, and you don't know which is their bad day or which time of their conditions. So it's not particularly reliable. I mean, they're better than some other methods, but what we want to try and do is replicate the dog on a good day.
So this is the key piece of kit, but it weighs what, half a ton? It's not very mobile, is it? How are you going to get that into hospitals?
Well, obviously, an instrument like this is not readily going to get into a hospital, certainly not on a routine basis. It might be possible to take it for a research project, but not on a routine basis. So ideally, what we want to do is when we have done the projects on particular conditions, identify 5 or 6 key compounds. And in fact, we're working on something.
Oh, wow.
So it's a bit this sort of size. And what we do is we'd either have this and we'd attach it to there and we'd give it to a patient and say, blow in here. Or perhaps you'd have a slot where you'd put your urine sample, would heat it up and would measure the vapour. And then this would either give you a readout, this could be configured any way you like, would either give you a readout of the concentrations of the different compounds, or in some cases that's still too difficult and not appropriate. You just want a red light to say someone needs further investigation, or a green light, someone's healthy and you can let them go. So this is our aim.
I'm looking at this and it reminds me of exactly the kind of thing that the police use when they stop you to test for drunk driving. Is it going to be a similar kind of thing?
Absolutely right, be just the same as that. So they'd just be asked to breathe in until they have a representative sample, and then the instrument will give you, just like in the police breathalyzer, a red light or a green light or whatever, tell you whether you've passed or failed, but only it would be, whether you need further investigation or not. And it would be just like that, except this will be much more powerful, because instead of measuring the relatively high concentration of one compound, which is alcohol, it will be measuring the concentrations at a much lower level, excuse me, of probably 6 or 7 different compounds. And the outcome of these analyses can actually be put together using some very sophisticated mathematics to produce quite a lot of information, probably about more than one condition. And that's what we're working on at the moment. So we're aiming to make something like this.
So that's your research, Claire. Can you tell me next about how that research feeds into the kind of teaching that you do?
Okay, so I've been at the Open University for quite a few years now. And when I joined the Open University, my main job really was to start working on the analytical science courses that we offer. And of course, I really like analytical science because it's totally cross-disciplinary. I happen to be working here on medical diagnostics. But in actual fact, this type of approach can be used across just about all of the scientific disciplines. So the analytical science courses that we offer will show this, and they show that you can use techniques such as this, but not only this, all sorts of different techniques, for not only use in medical sciences, but also in life sciences, where you want to try and find out about organisms or the growth of something or whatever, through to looking at the environment, what's present in the environment. We obviously all need to know this type of information, whether there's going to be a problem with air quality or water quality, but also through to things like looking at a painting, trying to find out whether it's a fake, or if you just got a painting, you want to try and find out what sort of pigments are in it, that sort of thing. To actually looking at space, if you want to find out information about how far a star is away. All this is part of analytical science. And the reason I'm so interested in it is because it just covers all the disciplines. So by taking some analytical science, you're going to be getting a lot of background science in that as well.
So students starting in science with us now, they'll be doing a degree in natural sciences. How soon can they expect to encounter analytical science?
There will be some analytical science in the new level 1 modules, which are going to be offered from 2016 onwards. But most students then, if they take sort of chemistry discipline, or if they do sort of interdisciplinary sciences, will do some analytical science. because it pretty much is the truly interdisciplinary stuff that underpins all of science, because we wouldn't know about these things if we didn't go out and measure and make observations and analyse stuff. And this is actually built into all the modules that we offer at level 1. So students will actually learn some analytical science right from the very beginning.
I just want to come back to your research now and this. How soon do you think something like that will be commercially available for detecting bowel cancer, say?
Well, I'm working on building devices just such as this, and I know other groups are as well. So I think in terms of a device like that will give you some basic information about whether someone has a particular disease or not, will probably start becoming available in medium term, probably about 5 years' time from now.
So that's fantastic.
Well, hopefully this is going to save lots of people from having to go and have lots of unpleasant and invasive tests.
Yeah. That's absolutely fantastic, and I wish you the very best of luck with that. It's been fascinating. Thank you.
Thanks.